how can we make people and our citizens understand that there is a direct link between people being thrown into poverty and proper health policy?
Nagesh, I think people understand first part of it. They may not understand policy. They understand that ill health is the single biggest cause of poverty. The poor understand it. The problem is they have given up on government because of 60, 70 years of shameful criminal neglect of governments and political parties. People no longer believe that it is the government's job at all. They have given up on the government. So they are trying to do whatever they can. Go to a local Ved or somebody, go to some quack, or go to some doctor available. If you are in Hyderabad or Bengaluru, go to a teaching hospital and then flock it for simple problems. We discussed our Institute of Medical Sciences gets 12,000 patients. Most of them are patients that should go to primary doctor. If you have a simple case of malaria or a viral fever or a cold, you don't require to go to teaching hospital. It's absurd. But because there is no other access of healthcare, you are going there. So people know already, but they have given up on government. The problem is that it is the government's central responsibility to provide quality care without out-of-pocket expenditure that is not internalized. So what are people asking now? Election time, give money for voting. Andhra Pradesh, Telangana have become the masters of that. And quite a few other southern states like Karnataka, Tamil Nadu, etc. Other states are following suit sadly in the country. Or freebies. Not education, not quality healthcare, not infrastructure, not job opportunities. No. Freebies. Per month I'll give you this much, I'll give you free power, I'll give you free this, free that. But poverty is not ending. So people understand the pain of healthcare. They are not looking at the government as the solution, as a part of the solution. In the process, what's happening? You are wearing beautiful white coats and the stethoscopes. You are seen as the visible symptoms of healthcare system. So a patient who is angry, not getting the healthcare that she needs or wants, had to spend a lot of money out of pocket because there is no proper public health system available. The anger, they are lashing out at the doctor.
Yes, sir.
30, 40 years ago, people in your place, they were treated as gods by the patients.
Yes, sir.
Patients were, I remember, when I was doing medicine or house surgery, patients in the most part were very grateful. We tried our best. Conditions were much weaker, much poorer than. Technology was weaker, resources were fewer, infrastructure was much worse. But despite that, we did the best under the circumstances. And people understood that, they appreciated that. Today, I don't think many doctors feel the appreciation. They feel the resentment. They feel the anger. They feel the suspicion. The public trust is broken. It is terrible for the society because not only is it bad for the medical profession, doctors work very hard, they live tremendously tense lives. Doctors' lifespan is shorter than the rest of the population. The people who save lives actually live shorter because of this anxiety and stress. So it's bad for the profession, but it's bad for the patients and the society because the faith in the doctor is about half of medicine. Yes, if I don't have faith in the doctor, trust in the doctor, to that extent, no matter what interventions are made, what medicines are given, they will not work as effectively as they should. So society is suffering in the process. Medical profession is suffering. So all this can be altered only when the government and the political system and the media and those who understand the role of the government, they realize good quality education, not any education. We have free education on paper, mostly third rate, but real good quality education without having to pay out of pocket, at least at the school level. Good quality health care without having to pay out of the pocket, at least for those who can't afford it. For the rich, they'll find their own means. In India, even if you say, I'll give universal health care, the rich people will not use it because already the practice is gone. They won't trust the government doctors and government hospitals. So be it. If they have the money, they have the means, let them do it. But the 70% Indians who utilize it, they must get free care of quality with competition and choice, with accountability. So unless we push the system towards that, there will be tremendous tragedy in the country. And good news is, slowly politicians are realizing. Andhra Pradesh, when they start Arogyasri, it's not only good for health to some extent, it gave them votes.
Yeah.
In 2009, Congress party was re-elected in large part because of Arogyasri. Many governments in the states and many parties realized that. So they all followed suit. National level, they are doing it now.
Nice, sir.
For the first time in India, they are recognizing there is vote in healthcare. The COVID pandemic exposed the vulnerabilities of the system. So they may not understand why or how, but they understand that healthcare should be improved. That people understand, because during COVID peak, lakhs of families, they lost their families. Somebody, a member of the family, they didn't have enough oxygen. They spent abnormal sums because of poor infrastructure in times of crisis. So people understand. Now it is for the political leadership and the media and the medical profession itself to make people understand that there is a solution available.
Yes, sir.
People understand the need for health care, but they have to figure out that the government must be the part of the solution. There is no other solution available.
Hi, this is Taman.
Hi, this is Shraddha Das.
Hi, I'm Priyadarshi. Nenu mi Adi.
Hi, I'm Kashish Vora.
Hi, నేను మీ శ్రీ విష్ణు.
Hi, this is Aditya.
Hi, this is Naga Anvesh.
Please subscribe to Social Post.
Please subscribe to Social Post.
Please subscribe Social Post.
Please subscribe to Social Post.